Good morning. We have seen about the started with the blood pressure regulation. We have discussed how the blood pressure is monitored. We have discussed the blood pressure categories and the risks. Now coming to the blood pressure regulation. Now hemostasis of the blood pressure regulation, that means the normal blood pressure regulation of the normal blood pressure and the volume. Now here this blood pressure is regulating by the number of the factors it is involved, number of the mechanism of involved. What happened whenever this hemostasis is disturbed? Yes, if it is hemostasis is disturbed, that means if blood pressure it is fall, clear, blood pressure it is decreases, clear, if we consider that blood pressure is decreases, then body it will recognize, clear, human body it will recognize that blood pressure is goes down automatically through the baroreceptor and all, and it will start the regulation of the blood pressure, try to increase the blood pressure. Now, this particular maintaining of the hemostasis, it is occurs via two different mechanisms. So, what are the two different mechanisms? One is the short-term regulation and another is the long-term regulation. Short-term regulation and long-term regulation. In case of the short-term regulation, it involves sympathetic activation, because sympathetic nervous system it is mainly regulating the you can say that blood pressure through alpha and beta receptor, and main neurotransmitter it is the noradrenaline. So adrenal hormone hormones and the noradrenaline it is there. So thereby they are increasing to the cardiac output, and the peripheral vasoconstriction increase the blood volume and the blood pressure, and as the blood pressure and the volume it is increased, blood pressure also it is increased and going to the normal. In case of this mechanism is the short term, but whenever we are talking about the long term, it is responsible for the renin angiotensin, that means renin angiotensin system. Now this renin it will be going to be released as the angiotensin 2 activation. Angiotensin 2 activation it will be responsible for the aldosterone secretion, you can antidiuretic hormone release, and you can say that vasoconstriction, and as a result again blood pressure it will be increased. That means peripheral vascular resistance is increasing, blood volume it is increasing, and it is maintaining the blood pressure. So that is you can say that the regulation. Now one by one we'll see about the long term regulation and the short term regulation. Now coming to the long term regulation of the blood pressure, that is the renin angiotensin system. Now angiotensinogen it is a plasma alpha 2 globulin. It is a plasma 2 alpha 2 globulin, and whenever there is a loss of the sodium, decrease into the blood volume, fall into the blood pressure or the renal ischemic condition, they will you can direct the low molecular density, because in that case there is the you can low molecular density of sodium level, low glomerular afferent pressure, and enhance sympathetic activity. So this will be the changes which will occur into the kidney. As a result, just a glomerular cell of the kidney, it will cause the release of renin. There is just a glomerular cell of the kidney, it will cause the release of the renin. When the renin it will be released, this angiotensinogen it will convert into the angiotensin 1 in presence of the renin. So renin is responsible for the conversion of the angiotensinogen to angiotensin 1. Then angiotensin converting enzyme, clear, it's or kinase 2 angiotensin converting enzyme. In presence of this angiotensin converting enzyme or ACE, angiotensin 1 it will convert into a angiotensin 2. So angiotensin 1 is the decapeptide and angiotensin 2 is the octapeptide. Then in presence of aminopeptides, it will form the angiotensin 3, which is the heptapeptide. Then angiotensin C, and again in presence of the aminopeptides, it will convert into the angiotensin 4, which is the hexapeptide. Now this angiotensin 1, it is responsible, it will act on the AT1 receptor. Clear? Here it will act on the AT1 receptor, angiotensin receptor 1, AT1 receptor, and it will cause the vasoconstriction. As a result, blood pressure it will increase. It will cause the sodium and water retention. Again, the blood volume it will be increased, and both the angiotensin 2 and angiotensin 3, it will cause the release of the aldosterone secretion from the adrenal cortex. Now, due to this aldosterone secretion, again there will be the retention of the sodium and water, as well as the blood pressure, it will be increased. Now, increase into the blood pressure, it will cause the increase into the blood pressure. Clear? Blood volume, it will cause the increase into the blood pressure. So, vasoconstriction, peripheral vascular resistance, it will be increased, and increased blood volume means blood volume, it will be increased. So, as a result, blood pressure, it will be increased. So, this is about the long-term regulation of the blood pressure. So, this is the renin-angiotensin system. Now, coming to the short-term regulation of the system. In case of the short-term regulation, say here the cardiovascular center, it is located. Clear? There will be location of the cardiovascular center. Now, input for the cardiovascular center from the higher brain center like cerebral cortex, limbic system, hypothalamus, from proprioceptor like monitor the joint movement. Clear? Proprioceptor, who is monitoring the joint movement, from the baroreceptor, which monitors the blood pressure, and from the chemoreceptor, which monitor the blood acidity. They are monitoring. Now, what will happen whenever there is a decrease into the blood pressure? This system, it will be activated, either the higher brain center or proprioceptor, baroreceptor, and the chemoreceptor. All these, it will be activated, and after activation of all this, they will send the signal to the cardiovascular system center. Clear? When they will send the cardiovascular center, it will be activated. Now, here we need to understand that the heart is innervated by the parasympathetic and the sympathetic nervous system. Clear? In case of the parasympathetic nervous system, acetylcholine is the major neurotransmitter, but in the heart, M2 receptor is located. Now, M2 receptor, it is responsible for the hyperpolarization, so they are decreasing the heart rate. But those are the sympathetic systems are there, like cardiac accelerated nerve, sympathetic, and vasomotor nerve, sympathetic, and parasympathetic is the vagus nerve. Now, this sympathetic, the noradrenaline, it is there. Now, noradrenaline. So, as a result, noradrenaline, this sympathetic system, it will going to be activated. As whenever they will get the signal that blood pressure is decreased, the sympathetic system, it will get activated. And in the blood vessels as well as the heart, there are presence of the alpha receptor and the beta receptor. Now, you can say that for whenever you can say the sympathetic nervous system, it will be activated, there is a flow of noradrenaline, they will increase the heart rate and the contractility, and blood vessels, they will cause the vasoconstriction. Now, if there is an increase into the heart rate and contractility, and if there is a vasoconstriction, of course the blood pressure, it will be increased. So, this particular phenomena, it is known as the short-term regulation of the blood pressure. Yes? So, this is the long-term and the short-term regulation of the blood pressure, the mechanism. So, hope you have gone through understood this mechanism which we have explained.